Hi, I'm Toby, I'm from Mercado Medic. In this video we're going to be taking a look at our medical range. This consists of our range to help hospitals with patient positioning, getting clearer imaging and improving their overall room efficiency while keeping their staff and patients safe. We're going to be looking at two models, one being the Rail 8100 radiolucent X-ray chair and the other being our Rail 8200 mammography chair and patient positioning chair. We'll get into the video now. Okay, so we're going to be taking a look at the Rail 8200 mammography chair. Although its primary function is mammography, it's not limited to mammography in the slightest. It works really well as a chair to get really good patient positioning as well as really good efficiency within your room through being able to transfer people into the chair from outside the room and move them throughout where they need to go really easily, and I'll show you how. So when it comes to patient positioning, it's really good to be able to get people into the right position. If you picture a mammogram, you need to be able to get in the right position when they're taking the imaging, and then in terms of clear imaging, it's great to not have any shaking, which can happen through standing. So although this really helps people who are disabled, or people who have mobility conditions, again, it's not limited to those people at all, as just getting good patient positioning can be achieved for anybody through being able to get them into a right position using the chair's functions. So in terms of the functions, everything's done via the remote, so it's really easy for staff to be able to use the chair, as well as it being better for imaging and for the patients. You don't need to worry about being able to lift them or raise them in any way manually. All you need to do is use the remote. So you can use the remote if you need to get them to raise themselves up. You've got two different seat height settings, so you can either have one that's lower, so starts at 40 centimetres, goes to 60 centimetres, measured from the bottom of the seat, or you can have 45 to 73 centimetres. You can raise them up and bring them down just as easily once you've finished, or if you need to transfer them again. You also have a tilt function, so this is good again for getting them in the right position and for helping them transfer once they're finished with their mammogram. So you can tilt forwards and you can tilt backwards 15 degrees either way. So with this, you've got really good positioning, and if the user needs a rest, you're able to then recline them so that they can take a break. Once you're finished with the mammogram, it's a really good tool to be able to help people stand up. If they can do a standing transfer, you can get them into a position where they're almost standing up, but the chair's still taking their weight. And then they can just push their weight off from the armrest to be able to get off the chair. These chairs are tested to the medical device regulations, so every part of the chair can take the weight limit, which is 150 kilograms. What you also would find is that you don't want the chair to be moving away when someone's transferring, or you don't want them to roll away when you let go of the chair. That's why every chair has a brake. So it's a foot brake, it can be with a lever, or you can have it as an electric button on the remote. And what that does is it lifts up the back wheels off the floor. The reason we do this is so that if anyone's hoisted into the chair, or if anyone falls into the chair, it eliminates any tipping risk, because when the back wheels are lifted, it means that they'll only ever catch them and move with them, as opposed to if the brake is on the caster, because that's where the pivot point will be created. If they need to transfer from a wheelchair, or if they need to do any sort of side transfer, the armrests can not only be brought out wider, but they can also drop down to assist with side transfers. And you can lock that in so that there's a platform to be able to move across. And then when you're in, you can bring it up. For people that are slightly wider, you can also bring the armrests in and out to make sure that they can fit into the chair properly. We have a foot plate that's really easy to flip back as well, so that people's feet are supported whilst they're having their mammogram, and they can flip it back for when they want to transfer out of the chair. You have precise positioning again with all of your headrest and backrest. You can change the height of the headrest to make sure it's in the right place so that somebody's comfortable, and you can adjust the headrest so that it can be brought further forward or further backwards depending on what support they might need. You have adjustments in the backrest through moving it back and forwards depending on who's using it, and you also have height adjustments for if people are taller or shorter. Once you have people in the chair, it's really easy to be able to move them around. You've got easy rolling 360 caster wheels with bearings in, so moving people is really easy, especially with the push handles. And this means overall you get clearer imaging and you can increase efficiency, because you then can set people up when they're outside, wheel them in to do the mammogram or whatever procedure it might be, and then you can do the procedure on the chair, and then when you finish you can move it out and either set up or bring in the next person. Thank you very much for watching our video on our Mikado Medic medical range. If you'd like to get in touch to try out one of these chairs, just let us know and we're more than happy to bring them to your clinic and show you and do a demonstration of how they work with your equipment. If you'd like to get in touch with us about any of our other clinical chairs, such as the dental x-ray chair and the standing support chair for surgeons and staff, please get in touch and we'll be more than happy to come and show you our equipment. Thank you very much for watching.